Good evening, everyone, and thank you for coming out to the Wisconsin Environmental Health Network Annual Conference. Okay, it's always technical difficulties.
It was working just a
It
minute.
was working.
Yeah.
Maybe I have to do it here.
I need to click again today.
I'll give it a.
Not it.
Oh my goodness.
Oh.
Okay,
Okay,
sorry.
I think I went too far. Okay, so first I'd like to acknowledge all of the sponsors of this event. You can read that up on that slide. And this is our conference team. So let's get started. So I'd like to welcome Dr. Bruce Lanphear. Dr. Lanphear is a preventive medicine physician and professor at Simon Fraser University, British Columbia, Canada. He obtained his MPH from Tulane University and his MD from University of Missouri. He's an expert on children's environmental health. And not only is he an expert, but he is dedicated to research on an array of toxins. He's conducted research on sources of lead exposure and health impacts of lead poisoning for over 25 years. He has over 250 publications. He's served on science advisory committees of the EPA, the CDC, the National Toxicology Program of the National Health, and the American Academy of Pediatrics. His research was significant in the decision by the CDC to declare in 2012 that there is no safe level of lead in the blood. So I welcome him here tonight to Wisconsin, and I also want to put a little plug in. He has a blog on Substack. It's called Plagues, Pollution, and Poverty, and he puts that up every Tuesday. It's excellent. I highly recommend that you sign on to it. So welcome, Dr. Lanphear.
Thank you. I've gotten a little bit older since the picture, which is about 20 years old. And I've been doing research now for 30 years on lead. So I'm getting older now. It's an honor to be here again. I don't know if this is the third time, but it feels like this is kind of a second home. I always enjoy coming back. And I want to talk about fluoride and fluoridation in particular. And I know somebody was a little concerned about the idea of calling this an experiment. But an experiment in research is actually the most prestigious type of study design. On the other hand, we've experimented on people like in Tuskegee, and that's not good. And that's exactly what we want to look at, because the question is fluoridation something that we should continue? Before I begin, a few disclosures. I have no financial conflicts of interest. I've served as an unpaid expert for a number of cases of childhood lead poisoning. I served as an expert in a tribunal of a physician who was accused of malpractice for advocating against fluoridation, and on behalf of the Whangarei district in New Zealand. In New Zealand, they've mandated that all districts must fluoridate their water, and this district said, we don't want to, and they asked me to write a report. I did. The funding went to Simon Fraser University, Artemis Fund. I can't use that personally. I served as a non-retained and unpaid expert in the federal fluoride case. I have received research awards involving lead, fluoride, and some other things. So at the outset, I want to start with a couple of quotes. One from Carl Sagan: at the heart of science is a balance between two seemingly contradictory attitudes, an openness to new ideas, no matter how bizarre or counterintuitive, and the most ruthless skeptical scrutiny of all ideas, old and new. So I'd like you to begin listening with a fresh mind. This is not about tribalism. It's not about what some leader may say that you completely disagree with. This is about trying to look at the science. Now, I'll start out. I said I don't have any conflicts of interest. I don't, but I do have biases. One of those is my research is intended to protect children. Second, I have seen a lot of chemicals that for a long time were thought to be safe, and we found that they weren't. So I come with that critical perspective. I also love population strategies. Population strategies, like vaccines, are why we live longer. It's why tuberculosis fatalities came down before antibiotics. It's why smallpox is gone. I love population strategies, but you got to get the science right. Because when you start mandating or doing universal exposure of something and you're not confident it's safe, that's dangerous. Some doctors are scientists, just as some politicians are scientists, but most are not. A scientist is somebody who constantly questions, generates falsifiable hypotheses, and collects data from well-designed experiments. The kind of people who brush their teeth on only one side of their mouth to see whether brushing your teeth has any benefit. So we rely on scientists like this. You may not want to live with one. But again, let's look at the data and recognize I have those biases. I can't drop those, but you appreciate them. So this idea of shifting the curve with a population strategy, it would be phenomenal if we could add something to the water and reduce the percent of kids who have tooth decay, right? It would be wonderful, wouldn't it? And that's exactly what H. Trendley Dean was hoping to do when he started to look at what happens as fluoride in the water supply increases. He found evidence that tooth decay decreased. Now, he was cautious. He said, look, we also know it causes fluorosis. We also don't know a lot about fluoride and how it impacts the population. He was quite hesitant at first about doing this. And in a way, fluoridation got away with society. And we'll talk a little bit more about that in a bit. Well, so what Dean showed was that as water fluoride levels increase, you see a decrease in tooth decay and an increase in fluorosis. And the idea of finding this optimal range or a sweet spot where you don't have so much fluorosis and you have a reduction in tooth decay was really quite appealing, right? It's in this era of better living through chemistry in the 30s and 40s. So this was really exciting. They came up with this range of 0.7 to 1.2 milligram per liter. In some ways, that accounted for people who lived in hotter climates. You wouldn't want to put as much fluoride in there because they get more, because they drink more. So they wanted a range of what was considered optimal. And there were concerns. In 1945, as they launched the first controlled trials in Grand Rapids with Muskegon as a control and in Newburgh, with Kingston as a control, Dr. David Ast, who was the chief of the New York State Health Department of Dental Bureau, assured the public that special attention will be given to mental development and emotional stability of exposed children. Now, why would they even worry about that? Fluoride had been used to treat people with hyperthyroidism. It was known to cause a reduction in thyroid production. And of course, you'd be concerned about that if children were exposed to something that could alter thyroid development or pregnant women. There was nothing ever done about this other than this assurance that we will look into it. There was never any report published on this question. Not surprisingly, there was a lot of excitement about this. They found a 65% reduction in tooth decay. And still, you can go see this sign in Grand Rapids, Michigan, and they're very proud of it. They also reported some evidence that in fluoridated countries, there was a reduction in tooth decay. But there was also a reduction in tooth decay in non-fluoridated countries. So that by itself really wasn't enough evidence to say this is making the difference. Still, the Centers for Disease Control in 1999 was quite excited about this and declared that water fluoridation was one of the top 10 public health achievements in the 20th century. So this excitement and this belief in fluoridation was part of the reason I should have said in 2016 when somebody came to me and said, would you help me study fluoride and fluoridation? You've studied lead poisoning and I know it was contentious. Would you study fluoride with me? And I should have said no. But when I'd been at Dartmouth 20 years earlier, 16 years earlier, doing a talk on toxic chemicals and Rachel Carson, somebody asked me what I thought of water fluoridation. And I said, well, I don't know. I haven't studied it. But one of the most important functions of public health is to study potential threats. So somebody should do it. And so when I was asked in 2016, and my first inclination was to say, absolutely not. I thought back to what I'd said 16 years earlier and said, well, I guess if I'm going to live up to what I say, maybe I should study it. So I did. I want to go through and just hit some of these chronological points that I think are quite important to understand this. So in 2006, the National Research Council was asked to evaluate fluoride and see whether the EPA's standard should be lowered. And they recognized three things: dental fluorosis, bone fractures, and skeletal fluorosis were all associated with fluoride, and that 4 milligram per liter was too high, that it should be lower. And they recommended that EPA consider lowering it. 20 years later, EPA has not lowered it. Now, there's even studies, I'm not going to talk a lot about bone tonight, but there's even studies from randomized controlled trials where fluoride supplement was given particularly to women to prevent osteoporosis and bone fractures. And what happens and why they did these studies is that fluoride increases the density of the bone. Or at least when you look at the DEXA scans, it looks denser. But they actually found that women who were in the experimental group who'd received fluoride were much more likely to have bone fractures. It makes the bone look denser, but it's not stronger, it's weaker. At least certain bones were more likely to fracture. At very high levels, you see skeletal fluorosis, where the bones essentially are just so brittle that they break. They raised questions about IQ scores, about whether fluoride could be neurotoxic, but it really was just maybe a suggestion. Most of the studies were cross-sectional. They were from India or China, mostly China, and most of us couldn't even read them because they were written in Chinese. Let's jump ahead to 2015. There were concerns because over the previous 2 generations, there was a fairly striking rise in dental fluorosis. Looking at 6 to 19-year-old children and youth, that's a clear signal that the children, that they were getting too much fluoride as children. That's what was causing the fluorosis. So in 2015, the US Public Health Service reduced the level considered optimal down to 0.7 rather than that range that I showed you earlier. And as I said, the EPA's maximum acceptable level of 4 didn't change, hasn't been changed. The World Health Organization uses 1.5 part per million, and a typical level might be 0.05, although there are some areas, for example, in New Hampshire, you can have a private well that has too much fluoride, both just from the rock where the water's coming from. So why were children getting too much fluoride? There's a number of different sources in our environments. Topical sources like oral hygiene products, fluoride toothpaste, and you'll notice here I chose a toothpaste amount that's typical for the toothpaste commercials. The toothpaste commercials squeeze it all on because it looks so cool, doesn't it? The way it does this. Um, but for a child, that's way excessive. What children are supposed to put on their toothbrush is like a little rice-sized schmear, and they shouldn't swallow it. But of course, kids do because it tastes good and it's got these cool characters on it. And so they're swallowing it. And we'll get into what that means in a bit. There's also sources of pesticides that contain fluoride, typically used in grapes, and of course, so it'll be in raisins. PFAS has fluoride in it. If you're on Lipitor, fluoridated water, of course, and unfortunately for me, because I love my black tea, particularly if it's like from the Rift Valley, tends to have high amounts of fluoride. So there's a variety of reasons. And so part of what was happening, presumably for these children, the last two generations of children, is that there was now so many more different sources of fluoride than they'd previously been exposed to. That's what was causing excessive exposure. Now, I want to just point out one thing here as well. What this tells us is the science of fluoridation is still evolving, right? It wasn't set in stone in 1945 and everything was known. It's still evolving. And here we can look at fluoride intake based on estimates from the EPA. So you can see, for example, in infants, and these are 6-month to 1-year infants, these are going to be formula-fed infants who are drinking water from the tap. We'll talk about breastfed infants in a minute. And you can see that food is a major source in infants, a source later on too, but you begin to see more from other beverages. And in the 1 to 4-year-old children, fluoride can be a major source as well. So there's a whole variety of sources we've got to think about, not just what gets into what is added to water. And if we look at children who are formula fed or breastfed, you can see the breast milk is in green. So children who are breastfed get very low concentrations of fluoride in their diet compared to children who drink formula made with fluoridated water. And in fact, many of those children are getting an excessive amount, more than is considered safe. Formula-fed infants given fluoridated tap water receive about 70 times more fluoride than infants who are exclusively breastfed. In some cases, like with DDT or PCBs, one of Henry's favorite chemicals, those are transferred in high concentrations in breast milk. Other chemicals like arsenic and fluoride aren't transferred much at all. And so breastfed kids are getting very little fluoride, particularly when we compare them to formula-fed kids when their formula is being made with fluoridated water. And this creates a bit of a challenge. We'll come back to this about whether infants even need fluoride to begin with. How does it work on the teeth? Right, so now let's jump ahead to 2012. And you remember I said some of those studies had been done in China. Anna Choi, who I think she spoke Cantonese, and Philippe Grandjean and their colleagues at Harvard did a meta-analysis. And they looked at as many studies that had been done. And not all of them were high-quality studies. Many were cross-sectional. But what they found overall is about a half standard deviation reduction in IQ scores in children with higher fluoride versus lower fluoride. And a half standard deviation is about 7 IQ points. So the children who had higher fluoride exposure had IQ scores that were about 7 points lower than children who had low fluoride exposure. So this was 2012, and this should have been a wake-up call, a red flag to say more research is needed. Our federal agencies should have paused and said, what research do we need to do to follow up on this meta-analysis? Well, unfortunately, that's not the way our science enterprise works in the United States. The way our science enterprise works, whether it's about whether fluoride is toxic, or whether that's about there's adverse consequences of lead poisoning, even at levels thought to be safe, is an individual scientist has to figure out how to convince the federal agencies to fund their study, even though many people will tell you there is no effect below 10 microgram per deciliter of lead. And you'll have to just keep trying hard to get that study funded, and then do one study and another study and another study and another study before they'll believe it. That's the way our system works. What I would prefer is that our federal agencies say, wait a minute, have you noticed there's a study that raises questions about the safety of this or of that? We need to fund those studies, but that's not what works. That's not what happens. All right, so this was mostly cross-sectional studies. It was in villages, sometimes in Iran or China. We needed better prospective studies. And the first one came from Mexico City, where they put fluoride in the salt. And what they found is looking at in utero exposure during early brain development, is that a 1 milligram per liter increase in urinary fluoride in the mother was associated with a 5 IQ point decrement in the children's IQ scores. So what they had seen in that meta-analysis published in 2012 was very consistent with what Bashash and others saw in the Mexico City cohort. Now, this raised some questions with people who were proponents of fluoridation, but they mostly just dismissed it and said, but it's fluoride and salt, and it's at levels that aren't relevant to our children in the United States. Well, we published this study 2 years later, and it did look at levels of fluoridation that were consistent with what was in the United States. This was a cohort in Canada, and we measured fluoride 3 different ways. We measured it in the urine of the mothers, and we had urine in the first trimester, and urine in the second trimester, and urine in the third trimester, and we took the average of all of those urine specimens. And we had estimates of water fluoride concentration. So we reached out to all the water treatment plants and found out their weekly measurements of fluoride, and we knew which women drank from their tap water. We only looked at women who drank tap water for that analysis. So we knew how much fluoride they were getting in their water. But we also knew we needed to take into account things like tea. And so we had a measure of fluoride intake. So urinary fluoride, a biomarker of exposure, what was in the mother's urine, fluoride intake, estimates from fluoride in the water plus tea, and then fluoride in the water alone. And what we saw was for the urinary fluoride, we saw 4.5 IQ point decrement, but only in the males. For the fluoride intake, it was about 3.4 IQ point decrement for each 1 milligram per liter of fluoride. And for water fluoride, it was over 5 IQ points. And as I said, this was about half of our kids, half of our families lived in fluoridated communities and half in non-fluoridated communities. So like in British Columbia, where I live, we don't put fluoride in the water. So now we've got a second prospective cohort study. We were attacked for this by US experts. Now I live in Canada. I'm a Canadian American. And we got some pushback about the study. We were accused of not sharing the data so that other people could look at it, but nobody actually had asked us to share the data. If they had, we would have told them, we're not responsible for it. This was part of a consortium, and there was a clear way that you could apply to look at the raw data, just as we had done. Now, I had helped to start that study, but I still had to apply for it, and anybody else that wanted to use it did as well. Well, they kind of exhausted that, and then they just accused us of fraud instead. And they sent letters to all of our university vice presidents and to the NIH, where we'd gotten our funding from. And some of our investigators couldn't do research for 6 months. Now, I never was contacted by my university president. Either they're inept or they said, look, this is academic freedom. I'm just going to assume it was academic freedom. So we were attacked, and one of the groups that attacked us was the American Council on Science and Health, and we'll come back to that in a minute. So you remember Carl Sagan, what he said at the outset. One of the pediatricians on the oral health section of the American Academy of Pediatrics response was, there are thousands of articles pointing to the safety of community water fluoridation. This study doesn't change the benefits of optimally fluoridated water and exposure to fluoride. Well, our study wasn't the only one. The same year that we published that, the National Toxicology Program put out their draft report in 2019 with this conclusion. The NTP conclusion that fluoride is presumed to be a cognitive neurodevelopmental hazard to humans is supported by the extent, consistency, and magnitude of the effect in the available data in children. All 13 lower risk of bias studies reported that a higher fluoride exposure is associated with at least one measure of decreased IQ in children across multiple populations. So what they were basically saying is there is consistent evidence. It's not just this one study. So at this point, we decided to create a video. And we had funding, this is called knowledge translation, to produce a video. And we decided that the public needed to know what we were finding and what the National Toxicology Program is finding. Even though it was a draft, the evidence was so consistent that we thought that this should go out and people could make choices. So I want to share this video that we put out. Is either 2019 or 2020, and hopefully the volume works. Oh, look at that. The impact of fluoride on brain development. For years, we were led to believe that fluoride is safe.
Dr. Harold Hart, a distinguished toxicologist on the Rochester team, has carefully investigated the safety of fluoridation.
Put it very simply, fluoride is safe at 1 part per million. Oh, we sometimes say is fluoride poison. Yes, of course it's a poison. In large doses.
Is fluoride really safe? Let's look at what we've learned over the past century. In the 1930s, a dentist discovered that children who drank water with naturally high levels of fluoride had fluorosis, the staining or mottling of teeth. Children with fluorosis had about 5 fewer cavities than children without fluorosis. Next, scientists showed that adding fluoride to drinking water led to less tooth decay. Unfortunately, tooth mottling increased as more fluoride was added to water. The optimal range or sweet spot to prevent tooth decay and minimize mottling was about 1 part per million. Meanwhile, the sugar industry, which knew sugar caused tooth decay, promoted the use of fluoride and mounted a campaign to thwart efforts to reduce sugar consumption. Then, beginning in the 1970s, soon after fluoride was added to toothpaste, cavities declined sharply in countries with water fluoridation, but they also declined in countries without fluoridation. Today, about 75% of Americans and 38% of Canadians drink fluoridated water. A new study showed that water fluoridation prevents about 1 cavity per child. Still, over 90% of Americans have tooth decay. Meanwhile, scientists began to find clues that fluoride was toxic for the developing brain. Everybody agrees that fluoride is toxic at very high levels. What about lower levels? In over a dozen studies, mostly from China, children who lived in villages with naturally high levels of fluoride had about 7 fewer IQ points than children in other villages, but those levels were somewhat higher than levels found in North America. 2 newer studies of pregnant women and their children, one in Mexico, where fluoride is added to salt, and the other one in Canada, where fluoride is added to water, also found that fluoride led to IQ deficits in children. As fluoride levels increased in pregnant women from 0.1 part per million to 1 part per million, the IQ scores of the children dropped by about 3 to 5 points. What about infants? As fluoride increased in infants, their IQ scores dropped further, especially in formula-fed babies. Infants who are fed formula made with fluoridated tap water ingest more fluoride than a breastfed infant. Breast milk contains very little fluoride. Some critics say that because our study was an observational study, we didn't dose pregnant women with fluoride like a drug study. It was inconclusive. But if we dismissed all observational studies, we'd have little evidence that water fluoridation prevents tooth decay. Some critics say it's only one study, but that ignores over a dozen high-quality studies showing that fluoride is toxic to the developing brain. Some critics say it's of little consequence if a child loses 3 to 5 IQ points. Is it worth losing 3 to 5 IQ points to prevent one cavity? Let's look at the impact of reducing children's IQ scores by 5 points. Most of us have IQ scores that fall between 85 and 115 points. Only 2.5% of children have an IQ of 130, which is considered gifted. There are about 6 million children in this group. On the other end of the distribution, another 2.5% of children have an IQ below 70, which is considered challenged. A 5-point drop in IQ results in a 57% increase in the number of children that are challenged, from 6 million to 9.4 million. There's a corresponding decrease in the number of children that are gifted, from 6 million to 2.4 million. What's more, children are often exposed to many chemicals that impair brain development, like lead, air pollution, pesticides, and fluoride. The impact of 3 or 4 toxic chemicals adds up and greatly increases the number of children who are challenged. What can you do? Pregnant women and infants should reduce fluoride ingestion. After all, it only benefits children once their teeth have erupted. If you are pregnant, don't drink fluoridated water or black tea. If possible, breastfeed your baby. Otherwise, don't use fluoridated water to make infant formula. Children should only use a right-size amount of toothpaste when they brush their teeth, not the amount shown on toothpaste commercials, and they shouldn't swallow it. Adding fluoride to water isn't the only way to prevent cavities. You can choose not to buy products from companies that market sweetened drinks and highly processed foods to children. After all, sugar is the main cause of tooth decay. So in the video, we talked about seeing these similar effects in infants. This was in the MyREC cohort again, and what we saw is that a 0.5 milligram increase in water fluoride predicted an IQ decrement of about 4.4 points in the formula-fed group. But we saw no association of water fluoride and IQ in the breastfed group. This held even when we accounted for prenatal exposure. So this fits beautifully with what we would have predicted, because the infants aren't getting fluoride from breast milk. It's only the kids who are getting fluoride in their drinking water. So are there benefits of using fluoridated tap water to mix infant formula? Now, there's a couple slides on here. I just want to start out with a bit of a caveat. I'm not an expert in dental caries. So this slide is based not on my research, but based upon dental researchers. And what they've said is that the beneficial effect of fluoride is post-tooth eruption and topical. It's not what's integrated into the enamel. It's when you brush your teeth. And we have evidence that toothbrushing with fluoride prevents tooth decay in randomized controlled trials. We don't have any of that with fluoridation. There's been, to my knowledge, only one study that looked at fluoride supplements in pregnant women, and that did not reduce tooth decay in their children. But we don't have randomized controlled trials. We also looked at whether the iodine status of the mothers, that is in utero exposure for these kids, had an impact. Did it protect them? Now, why would we suspect that? Well, fluoride, as I mentioned, was used to treat women with hyperthyroidism. And part of the way it does it is by competing with iodine. And so we hypothesized that the mothers who had low iodine, that their children wouldn't do as well. They do worse. And that's exactly what we saw with boys, because again, remember this with the urine, it was only the boys. So a 0.5 milligram increase in maternal urinary fluoride predicted an IQ of about almost 3 points in boys with higher urinary iodine. That is sufficient iodine, not excessive, but sufficient. In contrast, that same increase in boys with mothers had low urinary iodine was over 4.5 points. So we saw greater reductions. And if disruption of the thyroid gland is part of the reason, part of the way that fluoride leads to IQ deficits, then this would fit beautifully with that. Now, we don't know that, but that fits that hypothesis. And many of you probably can remember stories of cretinism. We don't call it cretinism anymore, but cretinism is severe mental retardation from children who were born when their mothers were severely iodine deficient. So this fits with that kind of a model. Low iodine impacting on the thyroid gland, and the children don't do as well in regards to intellectual ability. In the same cohort, the MIRIC cohort, our Canadian cohort, we decided to look to see whether fluoride exposure in the pregnant women, and this is with drinking water, led to an increase in hypothyroidism. And we saw that there was an increase, a 0.5 milligram per liter increase led to an increased likelihood of primary hypothyroidism in pregnant women of about 65%. Then we hypothesized that women who had thyroid peroxidase antibody, we actually thought that they might do worse. About 10% of women have this antibody, and the antibody is against the thyroid gland, and they often are hypothyroid. That seemed to make sense to us. But we found the opposite. It was the 90% of women who didn't have that antibody who were more vulnerable. And I think why that is because we can't see any signal at all with the women who already have the antibody against their thyroid. But we could see a signal with women that had functioning or better functioning thyroid glands. So in that situation where we only looked at the women who had normal antibody, that is, they didn't have what sometimes it's called Hashimoto's disease, and it increased from 65% to almost threefold. Then when I was being cross-examined in this federal fluoride case, one of the lawyers representing the EPA spent about, I don't know, must have been half an hour just hitting it again and again. Doctor, you can't say that these women lived in the same house for more than a year, could you, doctor? So you don't have any evidence that they've been exposed for very long to these fluoride levels in their drinking water. And I kept saying no in different ways because we hadn't looked at that. We hadn't published it. As soon as I got off the stand, I called Megan, who had done this. She's a PhD student at York University. And I said, Megan, I thought we looked at that. She said, well, you asked the question, but I forgot to do it. I didn't do it. I said, well, do it. So she did. And we saw that the signal was stronger if the women had lived in the same residence for over a year. Again, fitting very consistently with what we would have hypothesized. Now, one of the big criticisms we've had a few criticisms. One is people have said that urinary fluoride's an inadequate, flawed measure of fluoride. Well, for non-persistent chemicals like fluoride, like organophosphate pesticides, like bisphenol A, urine is the standard of choice. That's how we measure non-persistent chemicals, not just fluoride. And I've been doing this for 30 years, Beth, 30 years. This is what we do. It's standard. Now, we are also looking at tooth fluoride or dentin fluoride. We've got another study where we're measuring it in the toenails of pregnant women. Those could be quite informative because those are biomarkers of exposure, biologic markers of exposure that'll give us a longer measure of exposure. So like, for example, if we measured mercury in hair, not fluoride, for every centimeter of hair, I can give you a month of exposure in that pregnant woman. If you give me 9 centimeters of hair, I can measure 9 months of exposure. Toenails are kind of more like that than they are like urine. So we are looking at other things. The real limitation of urine, measuring urinary fluoride, is because the half-life of fluoride is only about 6 hours, it's quite variable. That means it's going to be much harder to see a signal. It's going to be easier to miss evidence that fluoride is neurotoxic. And so we shouldn't expect every single study to show the same thing. With lead, maybe 90% of studies show higher blood lead, lower IQ. But the half-life of lead in blood, weeks to months, much more stable. Okay, well, now let's look at the studies, because the other big criticism was that most of the studies that have been looked at aren't looking at the levels relevant for the US population, which is below 0.7 or below 1.5. And so this is a couple slides that looked at first water fluoride that Chris Neurath put together from Kyla Taylor's meta-analysis. And we'll come back and talk about Kyla's meta-analysis. This is actually the National Toxicology Program meta-analysis. And so what you can see here is that in the range of 0 to 1.5 milligram per liter, this is in the range where we expect children in fluoridated, women and children in fluoridated communities to be. In 7 of the 10 studies, we saw significant reductions in IQ with higher fluoride exposures, even in this range that's a little bit higher than optimal, but within that same range. Some of these are down lower than 1.5. So that's for water. And you can see overall, there's generally pretty consistent findings, not universal, right? These show no association. And the one study from Spain found that boys had a 28 IQ point increase from fluoride exposure. But that only happened after they corrected for urine dilution. And it's a little odd. And even the PI says, I don't get it. It doesn't make a lot of sense. But there it is for completeness sake. Now, what happens when we looked at urinary fluoride? And you can see, again, very consistently, we see more effects even in the range that we're concerned about. Now, some people have looked at this and said, well, look, this is more than 0.7. The optimal level is 0.7, so these aren't relevant. Well, this is the key thing you need to understand from that. We're not concerned about only water fluoridation, fluoride. We're concerned about total exposure, right? If we were only looking at water fluoride, we may still see evidence of harm, like in the previous slide, but the point is that kids aren't only exposed to fluoride in their water. They're exposed from their toothpaste, from pesticides on their grapes and raisins, from other things that we've already talked about. So we've got to have a measure of total fluoride intake. And that's what urine gives us. It's not perfect because it's variable, but it's a lot better than just looking at water fluoride. In most cases, water fluoride gives us a better indicator. So if we're just looking at people with no exposure in their drinking water and higher exposure, we can see differences, right? Like you did in the first 2012 meta-analysis. But we need, when we get down to these lower levels, to look at total exposure. The other thing to keep in mind, this is now looking at the pregnant women in MIREC during their 3rd trimester. And so in the fluoridated community, we can see that the 95th percentile of women is 2.4. How can that be? They're only drinking fluoridated water with a 0.7 part per million. How can it be that high? Well, there's 2 reasons. One, there's other sources of fluoride. And the other, just like with lead, you know where most of the fluoride in our body is stored? In our bones. And when pregnant women are trying to give their babies calcium for their bone growth, unfortunately, they're passing on lead that was stored over their lifetime, and they're passing on fluoride. So they're not only getting it from their pesticides they're eating on their grapes or from their drinking water, but also from the bones. We'll talk more about bones tomorrow. Bones are fascinating. So now I want to shift and talk a little bit about the National Toxicology Program. The National Toxicology Program is a cross-agency program focused on toxic chemicals. It started mostly with carcinogens, but they've been branching out. It used to be mostly about rats and laboratory studies, but then they started to look at humans. In this series of reports, first on animal studies, which they said there wasn't as much data, then they moved on to look at this monograph and look at cognition, and they focused predominantly on children because that's where all the data are. They can't say a lot about adults. And then ultimately, it concluded with this trio of meta-analyses in January 2025. This report has undergone a gauntlet of evaluations. It was reviewed twice by a NASEM committee, that's from the National Academy of Science and Engineering and Medicine. And both times the committee said, look, you've got a really hard job to do. You've got to go back and do a meta-analysis. You've got to go back and do these other kinds of analyses because you're trying to convince people of something that's going to be really hard to convince. Some of the proponents of fluoridation have taken that and said that NASEM said that this report was crap. That's absolutely not my interpretation. My interpretation is that that committee was saying that you need to do a better job presenting the data, doing a meta-analysis, which they did, and that's what we'll talk about here in the January 2025. What they were able to do is take advantage of a lot more data since the 2006 report. They had a total of 104 studies. And they've presented, this was in January 2025, they looked at water fluoride and urinary fluoride. They looked at high quality and low quality studies. That's the way you do these meta-analyses. But they looked at the high quality studies separately. And this table only looks at high quality studies. And I've converted the data from standard deviation to IQ deficits, just because it's easier for me anyway, and I think it is for most people. And so here you can see all the studies that were considered high quality studies, 5,000 children. They saw about a 3 IQ point decrement across the board. When they looked at lower levels of exposure, you can see that the size is comparable all the way down. At the lowest levels, less than 1.5 milligram per liter, the relationship was still inverse and very similar to the one above, below 2, but it was no longer statistically significant. So that's something that should be looked at, but we shouldn't rely entirely on it because it doesn't give you total exposure. And that's what the urinary fluoride does. And here you can see we saw lower decrements, and that makes perfect sense, right? Because we're only looking at part of their exposure. You wouldn't expect it to be any different. And in large part, we saw the same decrements and statistically not the same size, but we saw decrements down at the lower levels. And these were statistically significant, even at levels found in fluoridated communities. Now, one of the things we haven't yet done a good job of is separating out in utero exposure from childhood exposure. For some toxic chemicals, like PBDEs, like PCBs, we tend to see greater effects, like mercury, during prenatal brain development. The only one that I know which is greater afterwards is for lead. And even then, there's some question about if it's greater, but it certainly is at least as significant. So that's one of the subsequent things we need to look at. What happens next? Well, typically when you have this kind of a meta-analysis, this is what the EPA did for lead, is they do a meta-analysis and they say, do we see a consistent pattern? If so, then they will identify a study that's more directly relevant to the questions being asked. And then they'll focus in on that study. For example, is this focused on prenatal exposure? That's what we think we want to look at. They won't look at all of the data. They'll go and look at the studies that were prenatal. Or they may just take one large study that's particularly representative of people living in fluoridated and non-fluoridated communities. That's what they did with the lead studies. So our pooled analysis has been used by the EPA to estimate the impact of lead on IQ deficits, right? So there's hundreds, if not thousands, of studies on lead and cognition, lead and reading. But once they've got that big picture, the meta-analysis, then they'll often hone in on one or two studies. All right, so that's the research. Now I want to take a little different perspective. And for those of you who study industry, who've looked at things like the tobacco industry or the lead industry and how they have misrepresented research, this won't surprise you. But this study was published last year, and it kind of surprised me. This is one of the essays I did for Substack, and working with my brother, who's a graphic designer, we put together a timeline. Now, of course, I don't expect you to read that. If you go to Substack, you can magnify it and you'll see everything real clear. What I want to do is just pull out a couple of what I think are illustrative things that Chris found in his research on the sugar industry. In the 1930s, Gerald Cox of the Mellon Institute, with funding by the Sugar Institute, found that sugar accelerated tooth decay in rats and claimed there wasn't much evidence for it that he presented, but claimed that fluoride could reduce tooth decay by 20%. So sugar caused a lot of tooth decay, but you could blunt that with fluoride. Not eliminate it, but blunt it. He proposed adding fluoride to drinking water to prevent tooth decay, but did not disclose his funding from the sugar industry. In 1944, the editor of the Journal of the American Dental Association called fluoridation speculatively, it's not spectacularly, speculatively attractive, but warned that adding a highly toxic substance to drinking water, fluoride is a highly reactive chemical, that adding a highly toxic substance to drinking water carried risks that might outweigh the benefits. He was replaced within months by a friend of the sugar industry, Harold Hillebrand. Robert Hockett, 1954, decided to move over from his role as the scientific director of the Sugar Association to the newly formed Tobacco Industry Research Committee. And in his letter applying for that job, and you all know what the Tobacco Industry Association did, misrepresent the science, he talked about how he was able to convince people that sugar wasn't the problem and that fluoride was the solution. During the 1940s, the Kellogg Foundation, which then and still today had controlling shares of the Kellogg Company, which produces sugar snacks and sugary cereal, gave major donations to the American Dental Association. Emory Morris, a Kellogg executive, was made chair of an ADA committee that set dental health policy, and the ADA began promoting fluoride as a magic bullet to prevent tooth decay. Frederick Stair, whose role in the sugar industry has already been brought out in the New York Times and elsewhere for his role in sugar and cardiovascular disease, received annual retainers from Kellogg and Nabisco for more than 15 years, equivalent to about a quarter of his salary. And he said, there are no harmful effects from properly fluoridated water, absolutely none, to any person of any age in any state of health, not even mottled enamel that you or I could detect. Fred went on with his protege, Elizabeth Whalen, to co-found the American Council on Science and Health, an organization heavily funded by food, chemical, and tobacco companies. I was attacked by this group for my work on low-level lead poisoning back in the early 2000s. This was one of the groups that attacked us and accused us of fraud recently with our research in 2019 and beyond. In 1993, Bernard Wagner, who is the chair of the National Research Council's Committee on Health Effects of Ingested Fluoride, was paid $500,000 a year. That was a lot of money back then. From RJR Reynolds, which had merged with Nabisco. In 2003, Coca-Cola donated $1 million to the American Academy of Pediatric Dentistry, which promptly changes its policy statement from sugary drinks, a significant factor for dental caries, to not clear. Now, this is not my research, but it's meticulously written out by Chris Neurath in a publication that's freely available on environmental health. So I'd encourage you to look at it. Now, I mentioned that I was involved in a federal fluoride case. This was really quite remarkable. The EPA, under the TSCA Act, citizens can petition the EPA to regulate something like fluoride. If the EPA denies it, the citizens are allowed to sue the EPA. And that's what a group of citizens did, citizens and advocacy groups. They were also able to access information that otherwise would not have been available to them under this act. So they could subpoena federal officials. They could access email correspondence. It was really quite remarkable and really quite important, I think, if we're thinking about how to make sure that the EPA is protecting us. Just to give you another idea of what that means, I've been involved with lead for 30 years, Beth. Most of the major decisions that the EPA has made about lead first came about because not of research, but because of a lawsuit. Lawsuits are critical to make sure that the EPA is protecting us. Now, I'm not being critical of the people that work at the EPA. The mandate they have is inadequate. The resources they have is absolutely inadequate. And that's not just under Trump. That's been for the last many decades. We need to give them a stronger mandate and more resources. All right, there's another facet to this. I don't know how many of you know the Cochrane reports. This is a very well-known group that looks at randomized controlled trials to evaluate and synthesize evidence. Again, another caveat, I'm not an oral health expert. These people are. They looked at the evidence that fluoridation led to a reduction in tooth decay. And in particular, what they did here that was different than previous systematic reviews that they had done was they only looked at studies published after 1975, when fluoride toothpaste became widely used. And what they found was that studies conducted after 1975 showed that adding fluoride to water may lead to slightly less tooth decay in children's baby teeth. We could not be sure whether adding fluoride to water reduced tooth decay in children's permanent teeth or decay on the surface of permanent teeth. What did they mean by that? They saw about a 3 to 4% reduction in tooth decay, but it wasn't statistically significant. These results also included the possibility of little or no difference in tooth decay. So a lot of us have been operating under this belief that fluoridation leads to 25% reduction in tooth decay. What they're saying is in contemporary children, that doesn't appear to be true. They were also unsure whether there are any effects on tooth decay when fluoride is removed from a water supply. They just said we don't have enough evidence. That's another argument we often hear. We were unsure if fluoride reduces differences in tooth decay between richer and poorer people. That's another argument we hear. Yes, maybe rich children can brush their teeth, but what about the poor kids? Well, now we've got a different environmental justice problem, don't we? Because if you don't want to give your child formula made with fluoride and you're poor, you're going to buy bottled water? Because now we're creating a different kind of injustice where people who can't afford bottled water, and I'm not sure we want people to drink bottled water anyway. It's got other problems, doesn't it? Now, just to provide a little perspective, there are millions of people around the world, millions of children, millions of people who are drinking fluoride from natural sources. We've got to think about them. And in many cases, those are over 1.5 parts per million. So this is a global issue too. and in some parts of our country, like in New Hampshire, for example, and Vermont, there are private wells that contain excessive amounts of fluoride along with arsenic and other things. Now, I don't know how many of you know Jeffrey Rose. Jeffrey Rose is one of my heroes. And if you're interested in prevention or public health, this is one of the top 10 books I'd encourage you to read, Strategy for Preventive Medicine. And I don't even know what the other 9 are, but this is one of them. The situation is different, where individuals have no choice to reject a preventive measure. They can buy toothpaste with or without added fluoride, but if fluoride is added to the drinking water, they can hardly avoid imbibing it. We should expect a higher level of scientific evidence and popular acceptability for measures such as water fluoridation, which are imposed and not chosen by the recipients. So what I've tried to do tonight, and I know I'm biased, you heard what my biases were up front, is to present the data as objectively as I can, as I've understood it over the last 7 or 8 years that I've been studying fluoride. I think we need to give advice, or at least the option, particularly of pregnant women, to avoid fluoridated water, black tea, options so that they don't have to mix their formula if they choose to formula feed with fluoridated water. At a minimum, we need to provide that information, and that's why we did that. That's why we made that video. We also need to urgently set up a National Academy of Science, Engineering, and Medicine committee to look at all of this evidence, right? It's not enough for one person to have an opinion. We need to look at the evidence from people who have expertise in epidemiology, in fluoride. We need to look at the cost. You know, you oftentimes will hear that fluoridation saves money. I'll tell you what, you start messing with kids' IQ, it's going to wipe out any saving you see with cavities. Absolutely. For every IQ point a child loses, on average, their lifetime earnings, $20,000 less. Now, $20,000 may not sound like a lot, but multiply that by 2 million children a year. It's a big cost. And that's the same metric we use when we look at lead and IQ deficits. So I'm going to stop there. Hopefully, well, I don't know if there'll be comments, questions, critiques would be fine, absolutely fine as well. Thank you for the opportunity to present this, and hopefully you won't send a letter to NIH saying that I've conducted fraudulent studies, because it just creates lots of problems. We've already been cleared, by the way. So thank you.
I don't think it was announced that if there are cards on the table for questions. Have you been writing your questions down? No?
You could
I
just
have a
use-
couple. Yeah, we could just use the mic, I think.
Right.
There are a couple from my table. I'll just start with these and then we'll come around. How about that? So let's see, IQ tests do not measure many aspects of intelligence. They mostly just measure computation and logic and are culturally biased. How real is a 2 or 3 point decrease in IQ?
Real. It's historically, there have been concerns about cultural biases. When we go to Mongolia, for example, and we have to be careful. If, for example, you wanted to use a garage opener and say, what's this? You know, that may or may not be relevant. They know their horses though, and their camels, right? So you might want to be culturally appropriate. But they have modified IQ tests over time so that they can be trusted, and we do use them in policy setting. That's how our clean air standard was set for lead. Is there variability in the IQ measure? Yes. If I had a bad night's sleep, I may not do as well the next morning. But overall, it's going to rank me pretty well. Let's do away with IQ. We could use reading scores and math scores. That better? We see high correlations with IQ and reading scores. So it's a very useful tool. It's not everything, right? We are also interested in behaviors. And there's some evidence, I didn't talk about it tonight, that high levels of fluoride increases the risk of children developing ADHD. So we'll see more on that in the studies. But IQ is a very valid measure. I'm not a psychologist. All the work that I've done with fluoride and with lead that required IQ testing, I've always worked with the experts who did that kind of measure, but it's absolutely a valid measure.
Another question on IQ. Can you comment on when children or adults were tested for their IQ? Does it differ in each study? Is there an optimal age?
Yes, there is different, well, most of these are gonna be children, let's say 3, 4, up to maybe 10, 12, as I can recall it, maybe a little bit older. It tends to be more stable as you get older. So an ideal study you would hope for maybe 5 or 8 years of age. So when we found evidence, for example, at 3 to 4 with lead, we'd want to follow them up to 7. So a little bit later tends to be more predictive of adult IQ, adult functioning. So anyway, generally this was for children. Probably in the young adolescents, as I recall.
Questions?
Can I make a comment? So the slide that you had that had other sources of fluoride. So now in the pediatric clinics, children, once the teeth erupt, they're getting fluoride varnishes. So that's an additional source of fluoride in addition to the fluoride that they get when they go to the dentist.
Thank you.
Other questions?
Is there something in particular about black tea versus other kinds of tea? I mean, they're all made with water.
Yeah, it depends. Black tea does tend to contain higher amounts of fluoride. Higher quality black tea tends to contain a little less than lower quality black tea. You can also look at tea from different parts of the world, the Rift Valley, where I spent my 15th year of life. That tends to have higher fluoride content than tea, for example, from Ceylon. So you have to look at all of those factors. Green tea can have some, but it doesn't tend to have as much. But tea, is a hyperaccumulator. It does concentrate fluoride from the soil. It sucks it up, yeah.
Thank you.
Yeah. Can you please talk a bit about safety factor or uncertainty factor? Yes. So when the EPA recognizes that a chemical like lead or fluoride is toxic, they have to put into place a safety factor. And there's different kinds of safety factors. There are safety factors that say that children tend to be more vulnerable than adults. So you could put in a safety factor for children, typically a 10-fold safety factor. Interspecies, if all the evidence was done in rodents, rats in particular are really good at detoxifying things, you want to put in place a safety factor for interspecies comparison. Then you want to make sure that there's a margin of safety, right? In many cases, like with lead, there's no evidence of a safe level of lead. So why are we saying 0? Well, it's because it's like really, really impossible to get it down to 0 immediately. And so what's happening is the CDC ratchets down the level considered acceptable, although they don't use that word, they call it a reference value, which is equally euphemistic. Now if it's above 3.5 microgram per deciliter of lead, or 35 parts per billion of lead in blood, that's considered too high, and you want to identify what the sources are. In general, though, we want to go out in the environment and find out what the sources are and bring them down. That's to say that if there's a safety factor or uncertainty factor, you're going to take whatever point you find evidence of toxicity. Let's say it's at 0.7, for example. Then you're going to want to reduce that to make sure you're protecting the most vulnerable. Not just vulnerable because they're children, but some children will be more vulnerable. For example, what if the children were iodine deficient? That safety factor will help protect the most vulnerable. We may not know which kids are most vulnerable. We could predict that some kids will be genetically susceptible or vulnerable. That safety factor would also be there to help protect them, more than, let's say, the typical or average kid.
Yeah, you did some work on sugar, which is great. It's great, this kind of the political economy of the sugar industry versus that. What about the kind of the industrial components around fluoride and how that gets into the water? Have you done any research on that in terms of like the environmental? Because obviously naturally occurring naturally occurring fluoride is not what goes into most water supplies. Can you talk a little bit about that?
Yeah, I've looked into it a little bit, but not as thoroughly as I'd like, but I'll give you sort of a superficial view. I haven't been able, for example, to find which companies are promoting this and how aggressively they're promoting it and how they've been promoting it. But one of the major sources is from the fertilizer industry. It's a waste product. And that's the product that's used in quite a bit of municipal water supplies, the waste product. If that waste product had to be taken to the dump, it would have to be treated like toxic waste. So one of the questions I've had, I think this is what you're getting at, and for example, the Koch brothers own some of the big fertilizer industries. How much have they been behind the scenes manipulating this process, promoting fluoridation? I've not found any evidence that they have. If I was a Koch brother and watching what they do, trying to kill regulations, trying to get rid of Citizens United, I don't think this would be any different strategy than they've used for other things, but I don't have any evidence for that.
I have a couple of other questions here. Should communities be concerned about liability when deciding to fluoridate, knowing their risk?
Interesting question. Well, I'm not a lawyer, obviously. I think it's a valid question. I think the more important question would be our responsibility to protect kids. What I showed you, to the best that I can present the evidence, to understand and present the evidence, is that there's consistent evidence that fluoride is neurotoxic, down at levels found in fluoridated communities. There's only a little evidence that it causes hypothyroidism or is associated, a risk factor with hypothyroidism, but we do know in a meta-analysis that if you look at higher fluoride exposure, TSH goes up, and that's an indicator that it's doing something, disrupting somehow the thyroid gland. We've seen evidence, this is from the dental research community, that it's not systemic fluoride that's beneficial, it's topical. Brushing your teeth, we have randomized controlled trials. We don't have evidence from randomized controlled trials or experimental studies that fluoridation works. In fact, from the observational studies we do have, the Cochrane review suggested that there may not be in contemporary children the benefits that we've long thought. When I put all of that together, it seems to me that we've got, if not a liability issue, we've got a responsibility to ask whether we can justify any more. Now, one of the other costs I didn't talk about today is that we have been so fixated on fluoridation that we've failed to look at other risk factors. We just published a study last year, it's the second one I've been involved with, that shows that lead is a risk factor for tooth decay. Nobody talks about that. Vitamin D deficiency is a risk factor. May Mellenby found this 100 years ago, that kids who have rickets have tooth decay. Nobody's asking questions. Now, maybe I should do that too, but you can only do so much. But we should be asking these questions. How do we protect kids from tooth decay? Why are we so fixated on fluoridation? It's kept us blinded. One of the other criticisms you'll hear from people who are promoting fluoridation is that we don't have American studies. I can tell you why we don't have American studies. People are scared to study it. People are scared to criticize it. People are scared to question it. I was part of a scientific society, the International Society for Children's Health and Environment. It's a society I helped start. We're there to protect kids from toxic chemicals. It created a rift in our society. It almost separated us. The Canadians and the Mexicans, yes, we need to put out a policy statement. We didn't even say what the policy statement would say. We need a committee to get together to evaluate the evidence. And it would come back to council and we'd have to deliberate it. Canadians were fine with it. Scandinavians were fine with it on council. Mexicans are fine. Old Americans on council, were they afraid of it? They were afraid to ask questions. Why? That's just really striking to me. I mean, I can understand now, right? Nobody wants to be accused of fraud. But is that really the reason we don't have American studies?
Boy, there's a lot of good questions here. Are there other health impacts other than, you mentioned IQ points, of course, ADHD, hypothyroidism, and this kind of goes along with it. Do the IQ impacts of prenatal exposure and child exposure compound?
The study that I showed you looking at infants suggests that those were independent effects. So at least during early brain development, we saw effects prenatally in the MyRET cohort and postnatally. So when we adjusted for the prenatal effect, we still saw postnatal effects. And that kind of makes sense. The brain is still developing. Apparently they say that even my brain's still developing, but I'm not sure. Even into, adult, but clearly at that age, there's still a lot of development that's going on. So it appears so, but I think we need to do a better job focusing on the in utero exposures because some of the studies that I showed you had larger effects. Those tended to be the in utero effects. And that shouldn't surprise us if that holds up. Oh, so then ADHD, and I'm saying there's not as much evidence for ADHD, but it's generally consistent. Hypothyroidism, there's only 2 studies. There's the effect on TSH, an indicator of thyroid injury anyway, subtle. Only 2 studies looking at fluoride exposure, fluoridation, and hypothyroidism. The first one is out of the UK. It's a ecologic study, and ours was individual measures, a little stronger. So I think there's enough evidence to be concerned, but perhaps not say definitive or consistent.
Here's another one. Organized dentistry just expects all dentists to be supportive of community water fluoridation. Their default stance seems to be that the studies show fluoride, reduces IQ the studies showing fluoride to reduce IQ are weak. Comment on that, please.
Yeah. Well, let me just say a couple of things and use lead as an example. The studies that I've talked about today looking at fluoride and IQ are the same study designs we used to look at lead. And nobody's questioning those anymore, except for maybe a couple of the lead industry people. Nobody questions it. It's driven policy. It's widely accepted. The only difference is that we measure lead in blood, which has a longer half-life, and that's important. And we've got hundreds of studies, we've got high-quality studies. We've got dozens of high-quality studies with fluoride. We've got hundreds of high-quality studies with lead. But this brings up a whole different question. How many studies do we need?
What about people with disrupted or lower kidney function?
Yes, people that have lower kidney function will have a harder time getting rid of the fluoride and it can build up. Here's another interesting question. I'll talk about this in the context of lead tomorrow. I've not seen enough evidence on this. I've not seen evidence. I've looked for it with fluoride. What happens with women women have estrogen surges that push bone development. Lead gets built up in the bone. It's nice because it reduces their blood levels relative to men. But around menopause, women's blood levels spike by about 30%. And they spike higher if they didn't have babies. If they had 3 or more babies, the spike is lower because they'd already offloaded some of the lead onto their babies years ago. So a lot of the lead that's stored in our bone, and presumably the fluoride, is going to pick up after menopause, particularly the perimenopause period. I think this has big consequences. It does for heart disease. We'll talk about that tomorrow. I think it also does for cognitive abilities. And I'll give you a quick example. So my wife has near photographic, or did, memory. I could never win an argument. I mean, just boom. What did I wear this date 20 years ago? Boom, boom, boom. I really couldn't win an argument. Now, she's kind of gone through menopause, and now she's only twice as smart. She has a lot harder time pulling out details than she did before. Right? She doesn't have dementia, but something's changed. And I think part of what's going on has to do with menopause and what's leaching from the bone. We've got to be very careful of this with fluoride too, because that's where the fluoride is stored in our bones. If you look at bone fractures in women, there does appear to be a connection with excess fluoride, even with one ecologic study of children. Children who grew up in fluoridated communities are at increased risk for, I think it's the arm fracture, ulnar fracture. So we have to be asking more questions about these and not just keep pretending like thousands of studies have shown that fluoride is safe and effective.
Let's see. It's 8 o'clock, so maybe one more question here. Can you expand on the difference in impact between boys versus girls? Girls' IQ seem to increase.
Yeah, so that's a great question. There was a trend upward. It wasn't a significant increase. So my statisticians would say it's statistical noise. There's a little bit of evidence, like for example, a rat study that was done in 1995. Fluoride exposure had an impact on the male rats from prenatal exposure. For girls, it was postnatal. Overall, in the meta-analyses that Kyla Taylor did, they did not see differences in sex. So I think that even though we saw that in Myra, at this point, we are saying there does not appear to be sex differences in all of the evidence collectively. Does that answer the question?
You have another one? All right, are we still okay to keep going a little bit? PFAS, let's see, or fluoride, which is more dangerous?
Well, the nice thing about fluoride is that if we stop it, it goes away. PFAS, generations. The good thing about PFAS, it was done to us. The hard part about fluoride, we might be doing it to ourselves. It's easier when we can blame industry poisonous. That's not what's going on with fluoride. I think it's one of the real important reasons that we need to treat this an urgent public health issue. We need to evaluate it now. Because we've already seen all the distrust in American politics, American science, and we need to make sure that we get these kinds of population strategies right. And we can't let it fall into a tribalism thing that they say this because I'm going to say that. We've got to listen to Carl Sagan. We got to stop brushing one side of our mouth, whatever, but we've got to do it because we owe it to children.
There are so many more questions, but we need to wrap up, unfortunately. And first of all, I want to thank Bruce for this amazing, illustrative lecture tonight. It's brought up, I think, a lot of changes on all of our minds, how we think about this and how industry, has a hold on us in some ways, and how do we change the norm? So I appreciate it so much that you're here, and I'm appreciative of all of you being here tonight. Thank you for coming out. And one more thing I wanted to make sure you know about, if you're here to get CME points, there is a QR code there to scan, so I know about that. All right, thank you so much.
Okay, thank you.